Hey everyone, welcome back to the channel. Today we're answering a question that almost every lifter asks at some point: why does my back hurt after deadlifts? Taking care of your body isn't just about lifting heavier, it's about training smarter. Good health means maintaining your body, mind, and motivation over time. A healthy back supports everything you do, from lifting weights to living pain-free every day. Now, let's talk about what causes back pain after deadlifts. There are a few main reasons: poor form, rounding your spine, jerking the bar, or lifting too heavy too soon puts massive stress on your lower back. Muscle imbalances, weak core or hamstrings force your lower back to overwork. Tightness and mobility issues, stiff hips, hamstrings, or glutes can pull on your lower back during the lift. Fatigue. When you're tired, your technique slips. That's when injuries happen. Other lifestyle habits like sitting too long, poor posture, or lack of sleep also increase your risk. If back pain becomes chronic, it can lead to conditions like lumbar strain, muscle overuse or tear, herniated disc, when spinal discs press on nerves, sciatica, nerve pain down your leg, or even spinal misalignment from repetitive stress. Ignoring these issues can make daily activities painful, not just workouts. Some soreness is normal after lifting, especially if you're new or increasing your load. But warning signs of a problem include sharp or shooting pain during or after lifting, pain radiating down your leg, tingling or numbness, persistent stiffness, pain that worsens over days instead of improving. These symptoms mean it's time to rest, reevaluate your form, or see a healthcare professional. So what can you do if your back hurts after deadlifts? Check mark 1. Rest and recover, give your muscles time to heal. Check mark 2. Apply ice or heat, ice for inflammation, heat for stiffness. Check mark 3. Stretch and mobilize, focus on your hips, hamstrings, and lower back. Check mark 4. Strengthen your core, planks, bird dogs, and glute bridges support your spine. Check mark 5. Check your form, record your lifts or ask a trainer to review your technique. Check mark 6. See a professional. A physical therapist can identify specific weaknesses or mobility issues. Preventing pain is easier than treating it. Here's how to protect your back. Warm up properly. Dynamic stretches and light sets prepare your muscles. Use correct form. Keep a neutral spine, engage your core, and drive with your legs. Progress gradually. Avoid ego lifting. Add weight only when your form is solid. Get enough sleep and hydration. Recovery happens outside the gym. Regular mobility work, foam rolling and stretching reduce tightness. Strength training dates back thousands of years, but only in the last century have we understood the science of biomechanics and recovery. Studies show that maintaining good form and recovery habits not only prevents injuries but also improves muscle growth and longevity. Your body isn't a machine, it's a living system that needs balance between stress and recovery. Ignoring back pain can lead to chronic injury, nerve damage, or permanent movement limitations. Over time, even simple tasks like bending or walking can become painful. That's why early care and prevention are key. So, if your back hurts after deadlifting, don't panic, but don't ignore it either. Learn from it. Strength training is about building resilience, not breaking yourself down. Take care of your body, stay consistent, and remember, proper form and recovery are just as important as lifting heavy. This video is for informational purposes only and not a substitute for professional medical advice. If pain persists, consult a doctor or physical therapist. Stay strong, lift smart, and I'll see you in the next video.